Hi, thanks for tuning in. I'm Kristen Hayashi. I'm the Director of Collections Management and Access and a Curator at the Japanese American National Museum. And I am coming to you from my living room today. I'm not at JANM. We can't be at JANM right now because of the Safer at Home order. And we know that soon you'll kaeru and return to JANM to see our exhibitions and attend our public program. But in the meantime, we hope that you go to janm.org, check us out. If you go to the homepage, you'll see there's a section called JANM from Home, and it includes a variety of materials that our education, collections, media arts, exhibitions, and public programs departments are contributing to. We have educational resources and activities. We have videos about artifacts. We have just some of our public programs and films that our team has put together, and a variety of other things. So while you are at home and engaging with all this really great material from JANM, we hope that you'll tune in to programs like this one. It's a virtual program that our public programs department has put together. We're going to do many more of these, so stay tuned. But also just check out some of the other resources that we have available. And if you're finding that all of these resources are really engaging, we hope that you'll continue to support JANM by being a member or just making a donation to help support the great work that we're doing at JANM. So today I'm going to talk to you a little bit about a research project that I've been working on for a number of years on the Japanese hospital. And while I've had several opportunities to share the history of the Japanese hospital, I would have never anticipated that I would be giving this talk from home while we're all quarantined in the middle of a pandemic. But I felt like this program was really relevant to what is going on today. So the plan is that I'm going to speak to you for 30 to 40 minutes, hopefully, and then feel free as I'm talking to pose questions in the chat, and we'll try to answer those questions during the Q&A session after my talk. So again, the Japanese hospital is very relevant to what we're experiencing today. And while all of you are probably social distancing from home, you are probably inundated with all types of information that you never really thought about before. For example, this is the LA Times from last week, and on the front page it says, "Heed the lessons of 1918. You probably never gave thought to the 1918 influenza pandemic before recently, but the 1918 influenza epidemic had a really devastating impact worldwide on the population, killing millions of people. And so it definitely is relevant to the Japanese hospital story, which I will talk about in a minute. We also know that there's been a huge uptick of incidents of abuse and assault towards Asian Americans in the country in this time of COVID-19. Xenophobia, though, is a long-standing undercurrent in American society. And unfortunately, Asian American communities know this far too well. I'll address this and how it applies to the Japanese hospital a little bit later. And we're also directing our focus on data that's showing that communities of color appear to be affected by the coronavirus in significantly high numbers. This, of course, is not because they have an inherently higher propensity to contract the virus, but instead it's really shedding light on the systematic inequality that exists in American society. So we know that the increased risk of getting infected with COVID-19 is dependent on factors such as socioeconomic status, immigration status, occupation, housing situation, access to healthcare. And so all of these really play into the story of the Japanese hospital and shows why it's so relevant to what we are experiencing today. So the Japanese hospital is located in Boyle Heights, which is a neighborhood just east of downtown Los Angeles. And the story of it really illuminates the local Japanese American community's determination to ensure that immigrant and American-born Japanese had access to adequate health care in the early to mid-20th century, when mainstream hospitals were enforcing discriminatory practices and denied care to patients of color. So the story really begins in the late 19th century. This is an image that really was associated with Southern California. The sunshine, the citrus, the mild climate, all of this was touted by boosters and civic leaders as a way to show that Southern California was this place to get healed. And it attracted a lot of migrants and immigrants to the region. And while Southern California was touted as this prescriptive panacea for health seekers, we know that the region, even though it was associated with health, was not open to all Angelenos. In fact, health administrators and public health administrators or officials used race as a way to determine how to administer public health programs. Public health officials associated disease and filth with immigrants and communities of color. And so neighborhoods like Sonora Town or Chinatown, Little Tokyo or Boyle Heights were sort of associated with, again, disease and filth. And so these public health officials and hospital administrators sort of used race as a way to determine who would be eligible for care and public health programs. But healthcare wasn't the only arena where discrimination was rampant. As you know, in the early 20th century, the United States passed a variety of laws, so did states on the West Coast, that intended to limit and ultimately halt immigration from Asia. And there were also laws that were put in place to really hamper the social mobility of migrants and immigrants who are already here in the United States. One example is the Alien Land Law, which, as you know, immigrants from Asia, since they were non-white, were seen as aliens ineligible from citizenship. And therefore, the Alien Land Law, which was passed in 1913 in California, prohibited aliens ineligible from citizenship from being able to own land. And this plays into the story a little bit later on. There were also immigration laws that were passed that, again, tried to restrict immigration from Asia to the United States. So again, this xenophobia has this long-standing history. And yet, despite all the discriminatory legislation, the Japanese American community really started to burgeon. So this is a photograph of the Rafochuo Gakuen, which was located in Little Tokyo originally, very close to where JANM is today. This is 1918, and it's really just astounding to see all these children in the picture. And this is just a segment of the Japanese American community here, but during the influenza epidemic and sort of early on, the community was really growing, as you can see from this photograph. And while it does seem like there are a lot of children and individuals in this photograph, of course, the Japanese American community was really small in comparison to the rest of the Los Angeles population. And even though it was small, you had authorities, public health officials who really played up just how much the population was growing as a way, again, to further this xenophobic agenda and to justify the discrimination in healthcare. But, of course, the community needed healthcare. And so when they were denied entry into mainstream hospitals, you had midwives and itinerant doctors who would go around and administer healthcare to much needed families. So even though there were midwives going around, there was also a hospital. There was a Japanese American hospital called Turner Street Hospital. It was located in Little Tokyo, and it was operated out of a woman's house, Mary Akita. She was a midwife, and she used her home as a maternity ward because she saw the need for the community. And of course, the hospital was also able to admit patients for other needs, but it was a very small facility. This became really apparent during the 1918 influenza epidemic. And I just wanted to focus on some of these slides just because it's so relevant to our experience in this present moment. But this is from San Francisco. You see individuals lining up to get face masks. That was the mandate in San Francisco to try to prevent the spread of influenza. They required all the citizens there, or all the individuals in San Francisco, to wear masks. Seems very similar to our situation now, right? And in Los Angeles, the situation was, instead of mandating that everyone wear masks, they mandated that everyone quarantine. So it's their version of social distancing and safer at home. And this appeared to be working because Los Angeles, in comparison to other big cities in the country, didn't have as many cases of influenza. Nevertheless, there were cases, and so makeshift hospitals like this were necessary to care for the sick. Very little was known about how the virus spread, and so, of course, that led to individuals blaming immigrants and other groups, associating them with the virus. Again, very similar to what we're experiencing today. I found this article really interesting. This is from February of 1919 in the LA Times. And I had looked at this article for my research on the hospital, but I reread it recently, and so many things stuck out that just really seemed apropos. So the LA Times article just points out that Los Angeles, again, had fewer cases in comparison to other big cities, and they attribute that to quarantine, adding, of course, the Southern California climate, which helped to prevent the spread. But what's so interesting is that in 1919, because the cases were lower and not really increasing, officials decided that they were going to lift the quarantine mandate. And I just thought that their advice was so interesting. And, I'm asking, is it advice for 1919 or actually for 2020? Health authorities warned, though, that if they lifted the quarantine ban, they warned people not to let their pleasure over the improved conditions lead to carelessness, nor relaxation over the improved conditions. So just some advice for us to ponder now. So this is a photograph of outside of Turner Hospital. It was also called the Southern California Japanese Hospital. And this patient, Sunitaro Shigakawa, is receiving treatment for double pneumonia and emphysema. So again, the hospital was able to treat patients, but again, it wasn't really adequate to fulfilling all of the healthcare needs for the community. I'm sure his bed is outside because, it's a way for him to get some fresh air and some sunshine, which was supposed to be good for respiratory illnesses. It's not because they didn't have enough rooms, I think, but just a photograph there of the Southern California Japanese Hospital. So while Turner Hospital was this critical lifeline, it obviously wasn't adequate to fulfill the needs. And so, Japanese families were still dependent on these doctors and midwives to administer care. But when you have so many people who need medical attention, another solution was really needed. So because the community was growing, and of course because of the influenza epidemic, and then discrimination from being able to receive healthcare from mainstream hospitals, all of these factors really created the impetus for the Japanese community to organize its own healthcare practices and facility. This is Dr. Kikuo Tashiro. He was born in Japan. He was an Issei, and he studied medicine in Japan before immigrating to the United States. Once he was here in Los Angeles, he was practicing medicine at Turner Street Hospital, and also he had an office in Little Tokyo, and then visited patients at home. But despite passing the board exam in California, he was unable to find work in mainstream hospitals here in Los Angeles due to discriminatory practices. And so it was really, he led a group of 4 other doctors to envision a much larger healthcare facility for the Japanese community in Los Angeles. So in 1926, Dr. Tashiro and 4 other Japanese doctors, Dr. Daishiro Kuroiwa, Dr. Fusutaro Nakaya, Dr. Toru Ozasa, and Dr. Matsuda Takahashi got together, and they decided that they would have the resolve to form a corporation. So this is some of their meeting notes. This is a notebook that's in JANM's collection. Meeting notes regarding planning for this hospital, and I just thought that it was so audacious for them to say that we have this resolve to form a corporation that would become a hospital. And it just makes you wonder, like, all these 5 doctors were Issei men, which meant that they didn't have the rights and protections of citizens, and yet they had the resolve to move forward with this really bold idea. In the same year, Dr. Tashiro filed incorporation papers to try to incorporate the hospital, and he found that he was denied by the California Secretary of State, who said that the doctors had violated the Alien Land Law and also the 1911 treaty between Japan and the United States. This 1911 treaty between the United States and Japan was supposed to outline the rights that Japanese nationals had in the United States. And so that's what he was saying that the doctors had violated. The doctors, again, were very audacious and decided that they were going to stand up for their civil rights. It's very curious why the Secretary of State denied their application, because other businesses, Turner Street Hospital, had received incorporation without any problems. I mean, it could be that the alien land laws became even more stringent around this time, and so maybe that played into the Secretary of State's decision. Nevertheless, the doctors were determined to fight it, and so they took the case to the California State Supreme Court, and they had J. Marion Wright, who was a white attorney here in Los Angeles, represent them. So J. Marion Wright had attended USC Law School with 2 other Japanese law students. He was very sympathetic to the challenges that the Japanese community here in Los Angeles faced due to discriminatory legislation, and often represented Japanese nationals in various court cases and law cases. So he was very familiar with the discriminatory laws that limited them and took on this case. Little did he know this would be one of the biggest cases of his career. Again, so in that 1911 treaty, the language was so vague, and so that's what the California Secretary of State used as a way to sort of argue why the hospital shouldn't be incorporated. And J. Marion Wright and the Japanese lawyers who were working with him, including Seifuji, were very smart, and they used the ambiguity to make a counter-argument. They suggested that the language that described what Japanese nationals could do in the United States to further trade was so vague that it was all-encompassing, and therefore the hospital should count as a way to further trade and be acceptable in the 1911 as a result of the 1911 treaty. The California Supreme Court agreed with that and ruled in favor of the doctors. Well, of course, Frank C. Jordan, the California Secretary of State, didn't like the ruling, and so he contested it, and the case went to the U.S. Supreme Court in 1928. This is what makes the Japanese hospital, I think, different than other ethnic-specific hospitals. Other ethnic communities face the same sort of discrimination, and many communities decided to build their own hospitals. There are other Japanese hospitals, especially in the state of California. There's also a Chinese, hospital that cater to their ethnic-specific local communities. But what makes the Japanese hospital in Boyle Heights so unique is that in order for them to establish it, it had to go to the U.S. Supreme Court. So in the U.S. Supreme Court in 1928, Chief Justice William Howard Taft was presiding over the case, and when he was president, the 1911 treaty was signed under him. Therefore, he was very familiar with this. And from notes that we have, the arguments did not go very long, because as Jordan, or whoever was representing him, started to make their argument, within just a few minutes, Chief Justice Taft cut him off and ended discussion and upheld the lower court's ruling. And therefore, the Japanese doctors were victorious once again. So both courts ruled in favor of the doctors. And so that was in 1927 and 1928. Of course, the court cases made headlines. This was big news that the case went all the way to the U.S. Supreme Court. And this is the actual incorporation record for the hospital. And I just love this because just a few short months after the U.S. Supreme Court made its decision, Frank C. Jordan, the California Secretary of State, had to sign the incorporation papers allowing for the hospital to be constructed. And that was on February 2nd, 1929. This is also some notes from preliminary meetings, planning meetings for the hospital that are in JANM's collection. And so they're meeting here on January 23rd, 1929. And at the top there, they're calling the institution the Los Angeles Japanese Hospital as a temporary name, although that pretty much stuck once it was completed. But what's interesting about this document is it also just lays out the budget that they anticipate for the construction of the hospital. So they're suggesting $25,000 for real estate, $60,000 for the building, $15,000 for equipment, and then they also outline how they're going to get the money, mostly from sale of stock in the hospital, but also from a bank loan. On June 19th, 1929, groundbreaking for the hospital took place, and so behind these men, the street that would be behind that's First Street. And I imagine like where the photographer is standing would be on Fickett Street. This was a big day, I'm sure. And the construction of the hospital happened very quickly. The hospital opened on December 1st, 1929, to a huge fanfare here. It just shows like the real need for the hospital and the community. The community raised quite a bit of money to help build the hospital, and this was on the eve of the Depression. So that's another incredible feat in itself. The architectural style was in the streamlined modern style, and this was very hip. This was the hip architectural style, very modern looking for the time. It's the successor of Art Deco, and the architect was Yoshisaku Hirose. He lived locally in Boyle Heights and constructed several buildings in Little Tokyo and in Boyle Heights where he lived. So Tenrikyo Church was one of his designs and construction projects, Koyasan on First Street, and then when he was incarcerated at Poston, he also designed and constructed the school buildings there. So the architecture, even though it was in this modern style, it was very humble and very accessible and welcoming in comparison to hospitals like General Hospital, which was in this Gothic style and enormous and very intimidating looking. And I think that was the intention, was to ensure that this was a place that was open to all and that all were welcome. Of course, the focus was on the interior. Because of this need for a hospital, Dr. Tashiro and the other doctors wanted to ensure that there were state-of-the-art facilities that would help to tend to the needs of patients. There was a sunroom at the top that was to help provide therapy for respiratory patients where they could get some fresh air and also a lot of natural light as a way to help with the healing process. Of course, surgical facilities, Dr. Tashiro was a surgeon and wanted to ensure that there were state-of-the-art facilities for surgical procedures. Over the course of the 1930s, the Japanese hospital fared the Great Depression very well. They were able to provide health care for the community, keep it open. They delivered numerous babies and performed, myriad procedures that suffice the need of the community. Here's some nurses at the Japanese hospital. During World War II, when Japanese Americans on the West Coast were forcibly removed and incarcerated in America's concentration camps, the Japanese hospital continued to operate. the Japanese doctors, administrators of the hospital, made an agreement with nearby White Memorial Hospital in Boyle Heights to be the custodian of the hospital while they were away. And so White Memorial Hospital operated it as a maternity ward during World War II. And the administrators of White Memorial Hospital returned the hospital to the Japanese community after the war, and the hospital opened on, I think it was March 3rd, 1946, again as the Japanese hospital. And here's an announcement of the visiting hours and the operating hours of the hospital that was in one of the Japanese directories. The Japanese hospital continued to have a really enormous impact on the community in the post-war period. Dr. Shigekawa was a female doctor who went to med school before World War II, and she received discrimination right after Pearl Harbor in terms of she was working at General Hospital in Los Angeles. And she said that when she came back to Los Angeles after World War II, there was still so much discrimination in terms of employment. And so the Japanese hospital, not only did it provide healthcare to the community when that wasn't as accessible, but it also provided a workplace and a place for Japanese nurses and doctors to practice medicine. And she notes that she was very grateful for the Japanese hospital and its impact. So many Nisei felt the Japanese hospital was a real trusted institution, and many Japanese American babies were born there, as well as other ethnic groups. They also received treatment at the Japanese hospital. So it developed this reputation as being a very trusted institution, but also accessible to all. And we see that. We've heard so many different accounts of how the hospital has impacted a variety of individuals as we've been doing this research. And of course, there's so many Japanese Americans who have a connection to the hospital. But despite its ethnic-specific name, we've also found that there's so many just individuals who were from that East Los Angeles, Boyle Heights neighborhood who were not of Japanese ancestry, but received treatment at the Japanese hospital or were born at the Japanese hospital. This is a birth certificate for William Estrada. His mother, Lillian, had lost a previous, had a miscarriage during a previous pregnancy. And when she was pregnant with William, she received sound advice to go to the Japanese hospital to have her baby and that she would receive good health care there. And therefore, William Estrada was born there. And we know that there's so many others like William who, of course, were not of Japanese ancestry, but were patients at the hospital. So in addition to a lot of babies being born there, there are a lot of other procedures, as this receipt shows, for medical treatment and a stay and x-ray there. So by the 1960s, though, I think the number of aging Issei who required residential medical care really started to increase. And so in some ways, the size of the facility no longer met the community's needs. In 1961, the trustees' leadership of the Japanese hospital decided to sell it. The building was sold in 1966. And the building has been continuously operating as a healthcare facility, ever since it opened in 1929. Today, it's known as Infinity Care of East Los Angeles. This just shows the architectural history, how the building changed from its original design and construction in 1929. So it was after the Japanese hospital was sold in 1966 that all of these changes were made. But when you look at the hospital, it still has a lot of, it still looks like the way it did in 1929. So many of us in the community, since we have these connections to the hospital, felt that the story needed to be preserved, documented and preserved. And one way of doing that would be to nominate it as a historic cultural monument. So in 2015, I was a graduate student and approached the Little Tokyo Historical Society about a historic preservation project, and they mentioned that this was their goal for the Japanese hospital. And so this became my project to write the nomination for the local designation. And when we were about to submit the nomination, we sort of did a survey of just how many historic cultural monuments in Los Angeles represent the Japanese American community. And there are over 1,100 of these historic cultural monuments that have been designated by the city of Los Angeles. But just poring over the list, we felt at the time before the Japanese hospital that there were only 7 that outwardly represented, or maybe it was 8 that outwardly, 7 that represented the Japanese American community, despite its long-standing history in the community, or in Los Angeles, since the 1880s. And so slowly we're trying to sort of ameliorate that disparity. In 2016, the Little Tokyo Historical Society submitted the nomination for the Japanese hospital, and it became Historic Cultural Monument number 1131. And we also submitted a nomination for the National Register of Historic Places. And unfortunately, the owner was not supportive of the nomination, and therefore the Japanese hospital was determined eligible for the National Register. If the owner ever changes her mind, or if a new owner takes ownership of the building, then we would be able to very quickly change the status to being on the National Register. This is what the building looks like today. On December 1st, 2019, the hospital turned 90 years old, and so the Little Tokyo Historical Society threw a birthday party for the hospital, and we had over 100 people in attendance, and I would say over half of those in attendance had some connection to the hospital. And we passed around the mic, and it was just really meaningful to hear all the anecdotes of how the hospital had an impact on all those individuals' lives. And then on January 4th, 2020, the Little Tokyo Historical Society worked with the city of Los Angeles to create a sign that would at least pique people's interests, at least introduce a little bit about the history of the Japanese hospital. And so we had a sign unveiling on January 4th. And we really wanted the language on the sign to impress upon the fact that it was immigrant Japanese doctors that prevailed in the 1928 U.S. Supreme Court case, just to show, the revolutionary and audacious thinking of these immigrants, despite not having the rights of citizens. They really stood up for their civil rights and the need for this hospital. That was really important for us. Here's from the sign unveiling on January 4th. And so I just sort of want to end by just saying that the Japanese, hospital is a story of resilience. It's a historical example about how a community really united to fight discrimination and ensure access to quality healthcare for all. And I think it's a shining example of a civil rights victory that all Angelenos can really point to and be proud of. And so today, more than 90 years later, we're at a really historic moment. And I sort of want to challenge us to think about this. Like, how do we take advantage of this moment that we're in now? How can this example of the Japanese hospital inspire us to rectify these continuing disparities that exist in American society today? How do we use this as inspiration? So I just wanted to leave you on that note. And before we move into Q&A, I just wanted to thank all of my colleagues at JANM for helping me to put this together. It was very nerve-wracking to think about having to do this from home, and I could tell I'm a little jittery just from this whole production setup that I have here, and just wanted to make sure that the technology went okay. But I have such incredibly talented and skilled colleagues at the museum, too numerous to name, but I just wanted to thank everyone for all their help in getting this together. And I also wanted to thank the Little Tokyo Historical Society for all their support and their interest in preserving this really important story. So I think on that note, I will open it up if there are any questions that anyone has. I don't see any questions yet. Let's see. Do we have any questions? Any comments? Okay. Well, again, thank you so much for attending this talk today. And stay tuned. We're going to do a lot more talks like this, virtual talks that we hope you'll join us for. In the meantime, I do see a question. We have a question here. Are there any plans for an exhibition on the hospital? We should do an exhibition. As you could tell from the presentation here, there are quite a few historical materials we have historical photographs and also documents that could really help to tell this story. We also, in JANM's permanent collection, we have Dr. Tashio's medical kit, and we also have some of the prepared slides that he used for research. So it's certainly possible, and we definitely could still celebrate the 90th anniversary of the hospital by doing a small exhibition. That's a great idea. What are some stories from the hospital that you've heard? We've heard so many, and it's really incredible that this building just really means so much to the individuals who were born there, who had medical treatment there. I've heard so many people say that they've had their tonsils removed at the hospital, or their appendix removed, or they were born at the hospital. And all of these anecdotes have come out in various forms. When we were trying to get support for the Historic Cultural Monument nominations, we received a lot of emails where people shared their stories. Same thing at the anniversary, at the birthday party anniversary that we had last December. There were a lot of people who shared their stories, and so we're trying to capture those. So you should, if you have a story that you want to share with us, I would invite you to contact the Little Tokyo Historical Society. And you can send an email with your story, and we'll try to document that in our database. We still have not been able to locate any type of records, historical records, that tell us who worked at the hospital or who were patients at the hospital. So we're just anecdotally trying to collect all this data. But one really touching story, when we were at the Cultural Heritage Commission hearing, of course, the owner was not supportive of the nomination. And so we needed all the support we could get to help the commissioners realize the importance of the hospital. Of course, there are other items on the agenda that day. And there was a man sitting in the audience, Asian American man, who was there for a different agenda item. But when it came time to public comment for the Japanese hospital historical cultural monument agenda item, he requested to make a public comment, and none of us knew who he was, but it was such a moving testimony. He said that all his life he was wondering, where he was born, and his father had told him about this place called the Japanese hospital, but he didn't think it still existed. And so that day, he was just so moved to find out that his birthplace was still a physical place that he could go visit. And he got very emotional and teary-eyed during his public comment, and we were just so moved by that. And there's so many moving accounts just like that that we've been able to learn about through this project. Okay. Ooh, such good questions. So, okay, what is the current function of the hospital. It's currently called Infinity Care of East Los Angeles, and it's a convalescent care facility. What site would be your dream site to nominate for historic preservation? What a great question. I've also been involved with a nomination for Tokyo Florist in Silver Lake. That represents, again, the Japanese American community and the contributions that Japanese Americans have made to agriculture and horticulture and floriculture in Los Angeles. But it also represents women and the contributions that women have made economically to Los Angeles. So that's another one. But what I would really like is to be able to nominate the places that have importance to our community. And a lot of those aren't known for their architecture. They're known for the impact, the story behind the building and its usage. And so I would love to take, seemingly mundane places, yet so important to the community, and nominate those. So what comes to mind would be a place like Fukui Mortuary, which has had a huge impact on the community, like Toyo Miyatake's photography studio, the Miyatake Photography Studio, places like that that have been so just significant to the community, but may not be known for their, architecture. Okay, other questions. Can you talk about JANM's holdings related to the hospital? Yeah, so I think the majority of JANM's holdings that relate to the Japanese hospital were featured in this presentation. So all the photographs, pretty much all the photographs that you've seen of the Japanese hospital are from JANM's collection. The journal that had the meeting notes from some of those preliminary planning meetings, that's from JANM's collection as well. And then, as I mentioned, we have some material culture, some three-dimensional artifacts that belong to Dr. Tashiro. Okay. Another good question. Any estimates of how many Nikkei died in 1918? I don't know the answer to that. I know that, actually, I don't even know off the top of my head the number in Los Angeles either. But I imagine that the number of Nikkei who, died as a result of the influenza pandemic was pretty high in proportion to the size of the community, because that sort of seems to be the trend with, these communities of color and not having access to adequate health care. But I don't know the number off the top of my head. But it must have been significant if it sort of was the impetus to build a much larger medical facility. Has there been any ongoing contact by or outreach to other non-JA community members and families who were born or served by the hospital? It's a great question. We've, again, been learning about this broader impact of the hospital on other ethnic communities in the neighborhood, just anecdotally. So again, the Estradas would be one family. The individual who gave the public comment at the Japanese Hospital Cultural Heritage Commission hearing, but also at the birthday party that we threw last December. There were quite a few Chicano, Latinx families, individuals from the East Los Angeles neighborhood who talked about being born there. Or having some type of medical treatment there. So again, it's all anecdotal. We should do just more outreach just to find out, more about who is impacted by the hospital. And I imagine that social media could be a way for us to do that. So hopefully we further those efforts. Were Dr. Megumi Shinoda and Mitsuya Yamaguchi part of the staff? Good question. Those are names that I am not familiar with, but again, we don't have a comprehensive list of even the employees at the hospital. Again, we haven't been able to locate any records of who was employed there or who received treatment at the hospital. So it's very possible. And if you have an inkling, we can definitely put that in the database that we're starting to amass. Yeah. What was the greatest challenge in getting the HCM designation? Great question. So we're very fortunate. The local community, actually, we just had so many supporters who wrote letters, who made public comments at the Cultural Heritage Commission meetings, and those were all from the community, and we were very, very grateful for that. The challenge, there were two challenges. So one challenge was that, again, what I think made the Japanese hospital so welcoming and accessible was that, the architecture wasn't supposed to be the impressive part of the hospital, right? It was supposed to be the facilities on the inside. Historic preservation, although it's shifting, there is still a lot of emphasis on significant architecture. And so, there was some concern that maybe the architecture wasn't significant enough, or that the integrity of the building, since there were additions that were made, modifications that were made over the years, that it just didn't have the integrity. But the Cultural Heritage Commissioners felt that the story was so important, and so that turned out not to be as big of a challenge as we had anticipated. The other huge challenge, and it still continues to be a challenge, is that the current owner of the building is not supportive of these nominations. At the local level, that doesn't matter, and so that's why the designation went through, and it's a local historic cultural monument. But because the owner was in opposition, we were not able to get it on the National Register at this time. So that also explains why we weren't able to put a plaque on the building, and that's why we went with a street sign instead. That's on the sidewalk on a street lamp instead. Okay, did you run across any records of how the hospital received its revenue and paid for its expenses? Yeah, so again, we don't have a lot of official documents from the hospital. There was a receipt that I showed you that's in the collection that just shows a receipt for expenses related to medical treatment at the hospital. But we have come across a few stock certificates that some individuals in the community held, and if that was used to help pay for the construction of the hospital. But in terms of comprehensive financial records about revenue and maybe costs, we have not been able to locate any of those records. What is the best way to drive the message that API/Japanese American history is American history? That's a whole, we don't have time to address that really comprehensively, but, I think this is a really, really good example, the Japanese hospital. I think when you just hear the ethnic specific name Japanese hospital, you think it was just meant for the community. They were the only ones that benefited from the services of the hospital. And yet we're finding out that other communities, local communities, communities of color, experience the same discrimination in receiving health care. And so the Japanese hospital, served them. And I think this is a really good way, it's a good example to show that so many communities experience the same discrimination. And unfortunately, that is part of the American story. It's part of American history. And so I think using examples like this help people of, a variety of people to say wow, I can relate because, I've experienced some of the same forms of discrimination, or, I see resilience in my community, and here's ways that we overcame certain obstacles. I think that's what's so important, is that through these specific examples, you see these through lines that really unite us all as Americans. Okay. Is there a listing of physicians who practiced there in the 20s and 30s? We do not have that. We would love to amass a list of all of those who were employed at the hospital. Again, it's really just seeing mentions of them in historical documents or hearing anecdotally. That's how we're able to construct the list of who was impacted by the hospital or who was employed there. Not a question, but lots of viewers with personal connections to the hospital or Japanese American physicians. Yes, we've noticed that, and it's really, I think that's been the rewarding part of this project, is just to hear about all these connections that people have to the hospital. So keep them coming. Contact the Little Tokyo Historical Society with your your connections and your anecdotes, and we are amassing all that information. Okay, and we have, if the building finally receives the National Register designation, what benefit or changes would the new status give to the current owner? Good question. Yeah. If it has the designation, the owner can qualify for tax credits to rehabilitate the building. And as we know that this building, it's 90 years old, it needs some TLC. And I think it could definitely benefit from some money to do some rehabilitation. So that is one of the benefits. In terms of those of us who are supporters of the hospital and love it so much, we are glad that it has the local designation, because any types of changes that the owner wants to make need to go through review because of its historic designation. So that's a good thing. Okay. If the current owner decides to sell the building, what ideas have been discussed for a new use of the building? Yeah, wouldn't it be wonderful if we could get the building back into the hands of the community, local community, and it could be used as a healthcare facility as it has been. I've heard different ideas about that, sort of, fulfilling the need for residential care for the local community, but have it be in the community's hands. But I think there are a lot of other potential possibilities. There are 60 plus rooms inside the building that could be used for a variety of purposes, I'm sure. Wow, great questions. I see there's one more coming. Yes, I've been hearing from Mike Okamura, president of Little Tokyo Historical Society, who said some Boyle Heights members were born at the Japanese hospital. Yes, that's true. And we heard those stories at the 90th birthday party for the hospital. And again, not all of them were of Japanese ancestry, and it just shows the impact of the hospital and the local community. Okay, finally, can you share the Little Tokyo Historical Society contact info? Yes, I believe so. If you just search Little Tokyo Historical Society, you'll find our website. I think it's lths.org. Search Little Tokyo Historical Society. You'll get the website. But also there's an email account that you can send emails to, and I believe that's littletokyohs@gmail.com. But again, go to the website. I don't want to give misinformation. Yeah. So this happens to have been a joint project. It's a really nice collaboration between the Little Tokyo Historical Society and JANM. I am involved with both organizations, and it's just a good example of how we can use resources at JANM in our permanent collection to help uncover this history. So just wanted to get that in. Okay. Oh, Mike is going to send me the right information here. I know he's working on it right now. Contact information for the Little Tokyo Historical Society. But in the meantime, again, thank you so much for all these really great questions. I'm glad you find it very engaging. Okay, yes. So the Little Tokyo Historical Society's website is www.littletokyohs.org. Again, if you just Google Little Tokyo Historical Society, you'll find the website, which is currently being revamped, and a new fancy version of the website will be launched very soon. And you can also email the Little Tokyo Historical Society too. Oh, right. Okay. There's a question. Can you talk about the connection between the Japanese Hospital of LA and City View Hospital? Yeah, in some ways, the City View Hospital is a successor of the Japanese Hospital Some of the same leaders who administered the Japanese hospital also administered City View. But when the Japanese hospital, when it was clear that it had sort of that it was no longer able to fill the needs of the community, again with aging Issei needing more residential care, and that's sort of when City View Hospital was opened. So in some ways, it's a successor. It was a way to address the changing needs of the Japanese community after the Japanese hospital was no longer able to do that. Okay, I think we have answered all of your really wonderful questions. So again, thank you so much for joining us today, and stay tuned to JANM's website for more news about other virtual programs like this. If there's anything that you would like to see JANM produce, you can let us know. And in the meantime, go to janm.org, JANM from home, and also follow us on social media. And if you're finding this content engaging and you're really missing visiting JANM in person, I really would urge you to think about supporting JANM. And again, you can do that through renewing your membership, becoming a member of the museum, or donating to the museum. And it'll help us to continue to produce really great content like this program. So thank you so much. And that's it. Stay tuned for more programming from JANM. Thank you.